This is Dr. Arun Vishnar, and today I will be talking about how brain controls motility of GI tract and how GI tract affects brain. There is a plexus in GI tract. Plexus, I mean to say, network of nerves in GI tract, and this network of nerves is called mesenteric plexus. Now, this mesenteric plexus is in direct connection with brain through vagus nerve. Vagus nerve, it arises from brain and it supplies GI tract through various branches. So whole of the GI tract is controlled by the brain. So if there is any problem in the brain, function of the brain, then GI tract is affected. Suppose if patient is having anxiety, generalized anxiety disorder, or if a patient is depressed, or if patient is having some intracranial pathology in the brain, or pathology in the nerves, then in that case motility of GI tract is affected. Many patients with such type of problems of anxiety disorders, of depression, of cerebrovascular accidents, or any intracranial pathology, any tumor of brain, in these patients motility of GI tract is affected. Motility of GI tract is either is suppressed or there is excessive motility of the GI tract. So both things can happen. Constipation can occur in a case of central nervous system pathology, and even diarrhea can occur in the central nervous system pathology, or if there is any problem in the function of brain. The functions of GI tract, these are controlled by brain. As I said, it is controlled by the brain. But apart from this, there are various local hormones in the GI tract which also control motility of GI tract. There are n number of hormones, about 50 to 60 hormones are there which are secreted from GI tract. And these hormones, they have also effect on the brain. So this gut is also known as second brain. That is, brain and gut both are interconnected. So sometimes the gut is called second brain because if any problem happens in GI tract, then brain is stimulated and patient will present with problems related to central nervous system. So this gut motility, I was talking about gut motility, that it is controlled by brain. So the nerves are controlling this gut motility. Apart from this, there are various hormones, as I told you, about 50 to 60 hormones are there, neurotransmitters are there, which are secreted by GI tract. One of the hormone is gastrin. Now this gastrin is secreted by G cells of gastric antrum. Another gastric hormone is secretin, gastrointestinal hormone secretin. This is secreted by S cells of small intestine. One is cholecystokinin. This is secreted by I cells of duodenum and jejunum. So these are various hormones: acetylcholine, norepinephrine, vasoactive intestinal peptide, nitrous oxide, nitric oxide, gastrin releasing peptide, substance P, GIP, that is glucose dependent insulinotropic polypeptide. This is again a hormone. One is polypeptide YY, which is secreted from L cells of large intestine. Somatostatins from D cells of GI tract. Ghrelin is a hormone which is secreted from A cells of gastric fundus. So these are the various hormones. So these hormones are having stimulatory as well as inhibitory effect over the GI tract. So these hormones, they inhibit, some of these they inhibit the central nervous system, and some of them they stimulate the central nervous system. So if central nervous system is stimulated by these hormones, patient may present with increased GI tract motility. And if these hormones, they depress the central nervous system, then patient may present with decreased GI tract motility. That is, patient may develop constipation. If motility increases, then in that case, patient will develop diarrhea. So these various hormones which are secreted from GI tract, they have effect on central nervous system. There are n number of microfloras, microbacteria in the gastrointestinal tract. Now these microbacteria, they also secrete various neurotransmitters, various hormones, and these hormones also affect GI tract. So these microflora, whenever the microflora of GI tract is altered because of problem related to diet, because of problem related to less intake of fluid, because of problem related to intake of some drugs, if this if patient is taking, if person is taking antibiotics frequently, then in that case the microflora of intestine, the natural microflora, that is altered. And when it alters, the hormones which are secreted by these microflora, the levels of those hormones again go down. So again motility of intestine is affected. So whenever whenever any physician, any gastroenterologist want to maintain the restore the motility of gastrointestinal tract, he will have to manage the microbacterial flora of intestine by using probiotics. He will have to manage the functions of CNS, functions of brain, in order to control motility of intestine, motility of gastrointestinal tract. So whenever there is a patient of disturbed motility of gastrointestinal tract, one has to one has to see towards the function of brain. We'll have to examine functions of brain as well as functions of GI tract. And once you control the functions of brain, once you control the function of brain, the function of intestine will get controlled by itself. So it has been seen that whenever there is any life stress, whenever there is any anxiety, or whenever a patient is depressed, in that case motility of intestine is affected. So in these cases, when we use antidepressants, anxiolytic drugs, we advise patient relaxation exercises. So all these methods of treating the motility of intestine affects and it cures the patient. So at the end of this short lecture, I will like to say that gut and brain axis is very important part of motility of intestine. So whenever you want to treat a patient of disturbed motility, abnormal motility of intestine, always treat the brain functions as well as GI functions, that is gastrointestinal functions, both. Thank you.